So the next speaker is Marianne Levitsky, and I've had the great honour of working with Marianne since about 2011 with Workplace Health Without Borders. And so she's the founding member, she's the initial president of Workplace Health Without Borders. And I just think everybody should know, in 2019, Marianne actually was awarded the Yant Award through the AIHA. And that's probably one of the most prestigious awards for people outside of the US.
Thank you so much, Kevin. So I wanted to give an update on rapid testing for COVID-19, because at least in North America, it's become a very topical issue. And there are a lot of people who think it can make a real difference in the way we're going to be opening up our institutions. So a caution, I'm not an expert in testing. But I have been doing some consulting on COVID, and as a result of that, I've done a lot of research on this topic. And I will go through this fairly quickly. I'd be happy to answer questions or speak another time if people want more detail, or get a more expert speaker than me at another time. But just sort of a high-level overview. When we talk about COVID-19 testing, there's essentially three different kinds we talk about. There's RT-PCR, which I will tell you more about in a few minutes, which detects the RNA, the genetic material in the virus. There's antigen testing, which detects protein in the virus. And there's antibody testing, which detects antibodies in the blood of people that had it in the past. And we're not going to talk about that today. But I just want to make it clear the difference between antibody testing, which is kind of to detect past infection, and antigen testing, because they get kind of mixed up. They both use antibodies, which detects current infection, or at least that's the intent. So major considerations in testing selection are listed here. And some of the things that have been talked about a lot recently are saliva tests. We're all familiar with the swab tests that have been done recently. But there's a lot of interest now in saliva tests because it's a much easier kind of sample to get. Here are some of the other considerations which I will mention shortly. So what do we mean by RT-PCR? It's called reverse transcription polymerase chain reaction, sometimes reverse transcriptase. It's to identify viral RNA, and I'm not going to tell you a lot about it in the interest of time, but there's some really good videos on YouTube that will explain it. It's considered the gold standard of the test, and all the other tests that have been emerging recently are generally measured against how good, against the PCR test. So it's the best for diagnosing illness, and is the one that's been used pretty much since the start of the pandemic. Problems with that is it can take a relatively long time to get a result. That time has been coming down, but I think we've all heard stories of waiting a week, even more, for results, which, as we probably can figure out, doesn't help a lot if you're trying to stop an infection in real time. It must be analyzed in the lab or with some fairly expensive equipment. So it's relatively high cost compared to some other options. So what are antigen tests? They're tests that detect the viral proteins in the SARS-CoV-2, which is the COVID-19 virus. It's less sensitive than PCR, i.e. you get more false negatives, and sometimes you also get more false positives. But the current question, the great interest now, is that there's hope that there can be a cheap, rapid antigen test that can give almost immediate results. For example, a paper strip saliva test, which they're talking about could cost $1 or less, that everybody could have, take it at home, spit on this strip. If it changes color, it's positive. These are not now available, but that is kind of what a lot of people are talking about, and feel that it may be a game changer in opening up institutions. So just imagine if everybody who needed to go to school could take this test in the morning before they went to school. Anybody who was positive would not go to school that day. That's kind of what people are thinking would be a big change. So why should we care? Well, if transmission were only happening with symptomatic people, it wouldn't be a big deal, because we've been doing all this screening for symptoms. We take people's temperature, but we know that a lot of the transmission is happening with people who don't have symptoms, or they don't have symptoms yet. They're going to come down with symptoms soon, but in that time when they're pre-symptomatic, they can transmit. And that's where a lot of the contagion is coming from. So the concern is catching people who are infectious before there's any other symptoms. Tests are being developed that are cheaper, quicker, and easier than the gold standard. But as we know, they have lower sensitivity. If we can use this for screening, we can reduce the likelihood of a contagious person being in a setting with a large number of people. So the main person who's been talking up this idea is a professor and a physician at Harvard University named Dr. Michael Mina. And he's saying that rapid, cheap, low sensitivity testing will allow screening of large numbers. And he actually says low sensitivity is actually something you want. And this graph he uses in a video, and I've given you the link here, explains why you actually may want to have, sorry, I'm trying to find that little cursor that Dr. Wang uses so I can, okay, is that, yeah, there we go. Okay, so what he says is the PCR is like measures here. So it measures people with a much lower level of the virus. Whereas antigen testing may measure here. People need to have a higher level of the virus, and the x-axis is how much virus you have in your sample. And what he says is, this is where people are infectious, this big hump in the curve. So if you're missing all these people, well, you just kind of have to live with that. They're going to get more infectious and they're going to be more contagious eventually. If you're missing people here at the tail end of the curve, it doesn't really matter because they're not contagious anymore. And what happens is you get a lot of people who are testing positive, but you don't need to keep them at home because they're not contagious anymore. So what he says is this rapid screening, yes, you'll miss some people who are contagious, but you'll still get a lot more people at the really infectious stage for cheaper and quicker than you would get from PCR. And remember, this is a screening test, and this is an important thing to remember. It should not be relied on for diagnosis. So if you think you have symptoms, you should get a proper test. But if you're screening large numbers of people with this test that misses some, but it gets a lot others, it's better than not testing those people at all. What you're doing is reducing the risk that a contagious person will be present in a large population where they can spread it. So that's kind of the idea of that. So what's been happening? Well, a lot's been going on. So they're called rapid antigen tests. They're being used in some countries. Now, usually they still have to have some kind of laboratory analysis. There's a fast turnaround, but you're not at that point yet with the paper strip and the saliva test. They're still doing it through nasal swabs, but we can see it's being used in India. It's being used in Malaysia. Korea did pilot it. Was sort of out of the gate first with these rapid antigen tests, and I would like to ask Van if they're using in Vietnam. So what are the delays in US and Canada and other countries? Tests need to be approved by the FDA, Food and Drug Administration in the US, and Health Canada in Canada. And this is what it says, this clip here is what is clipped from the Health Canada website, which says at this time, Health Canada does not consider the benefits of using the home test outweighing the risks. So they're kind of afraid people will be using these tests, say, I'm good to go, I don't have it, I can do whatever I want. I mean, that is a danger because you cannot assume that you don't have it if you test negative. It's a screening device, it's not a diagnostic device. Things are happening quickly. This is was from a website I clipped just yesterday. Abbott has come out with a $5 15-minute COVID-19 antigen test that received FDA emergency use authorization. Still not a spitting on a strip at home, but much quicker and cheaper than the alternatives they were using before. You might have heard a fair bit of interest recently about another test that got FDA emergency use authorization. It was prepared by Yale University and the National Basketball Association. So you can test all those basketball players. And it's based on saliva. Again, requires lab analysis, but saliva, as you can imagine, might be a lot easier to collect than a nasal swab. So there's a lot of interest in that here in the Toronto the medical officer of health, says that would be great for the Toronto school system. Another thing that people are doing is pools testing, and that means testing samples from a big cohort to see if anybody in it, you don't know who, anybody in it has the virus. And what the University of Arizona is doing, they test the wastewater from the dorm. So they test the sewage essentially that comes out of the dorm, because the virus is contained in feces. And they found a positive case at one dorm. They isolated that dorm, and they credit that with limiting the spread of the virus. After they got that one positive from the wastewater, they tested everybody in the dorm. They found 2 positive cases, and they were able to prevent it from spreading anywhere else. So there are a lot of options that can be used now. And I think, you know, some of this is we need to be pressing the authorities that have not approved this to approve this for screening. Remember, we have to all understand what it's good for. It's not good for diagnosis. It's good for screening. It's another tool like asking people symptoms, taking people's temperature, but it really gives us a lot of potential. So I kind of wanted to share that today, because there are a lot of people here who are in a position to speak to their governments, to speak to their institutions, and find out what are the opportunities for this. So that's my presentation on this topic. Thank you.